Radiotherapy is just one treatment option your doctor may recommend, on its own or as part of a combination to treat your cancer. The treatment area and number of treatments depend on your specific type of cancer, any other treatment you have had or are going to have. Radiotherapy treatment is painless and should take between 10 and 20 minutes each day. It is similar to having an X-ray taken. It uses ionizing radiation or high-energy X-rays, which work to destroy the cancer cells in a treated area. Precision planning aims to give the highest chance of curing or shrinking the cancer, minimizing the treatment of healthy cells and reducing the risk of side effects. The process does not make you radioactive, and it is safe for you to be around others, including children. Depending on your individual treatment plan, your doctor may recommend that radiotherapy treatment is to be given inside or outside of the body. External radiotherapy uses a machine called a linear accelerator, or LINAC, and is the most common type of radiotherapy. It delivers targeted and precise X-ray beams. The targeted radiation delivered from the LINAC cannot be seen or felt, and is similar to that used when taking an X-ray of a broken bone. A team of clinical research radiographers are employed by the Northern Ireland Cancer Trials Centre, based at the Cancer Centre. Clinical trials help to improve knowledge about cancer, develop new and hopefully better ways of looking after and treating patients. Your doctor will discuss your treatment options and any clinical trial that may be suitable for you. Before you begin treatment, you will attend a specialist radiotherapy planning appointment in the Radiotherapy Department Assessment Suite at the Cancer Centre at Belfast City Hospital. Here you will be given specific information about your radiotherapy treatment, and the doctor will ask you to complete a consent form. The doctor will discuss your radiotherapy treatment and any side effects, both short-term and long-term. This information is very important so that you can give your informed consent to the radiotherapy treatment. The radiotherapy planning appointment may take up to 2 hours. We have a CT simulator specifically designed for planning radiotherapy treatment. You may have to lie on a special board so that you're in the same position each day for radiotherapy treatment. We may need to give you an oral or injected contrast dye. This will help us to see the area we want to treat more clearly. We will let you know if we need to do this. The radiographers will need to place some markers on your skin, which show up on the scan. Once the radiographers have you in position and you are as comfortable as possible, the couch will be moved through the scanner. The scan should only take a few minutes. During the scan, the radiographers will watch you from the control area. After the scan, the radiographers will make permanent ink marks on your skin. These are called tattoos and will be about the size of a pinpoint. They are an essential guide to your treatment and ensure you lie in the exact position for all future treatment appointments. Advice will be given at planning as regards looking after them. We have a large X-ray machine called a simulator. This is similar to the treatment machines. You will lie in the position we need you to be in for treatment, with the treatment area exposed. The radiographers will take some X-rays to check that your treatment position is exactly as your doctor has planned. Some people will only visit one of these machines. Others may come back to this machine during treatment. This will depend on the treatment you are having. Your doctor will discuss this in more detail with you. There will be no results from any of these scans, as they are only used to plan your radiotherapy treatment. Sometimes it may be necessary to have some personalised equipment made, such as a mask. These are usually designed and fitted during a prior appointment in our mould room. They allow the radiographers to accurately position you for your treatment. Once your radiotherapy planning appointment is finished, you will be able to go home. In most cases, you will be contacted at a later date, by telephone or a letter, with details of your first radiotherapy treatment appointment. Following your radiotherapy planning appointment, your doctor, with the help of the radiographers and physics team, may spend a number of weeks designing your radiotherapy treatment. This is a highly skilled process, and there is a lot of work behind the scenes to produce a tailored, individual treatment plan for each patient. Careful planning of your individual radiotherapy treatment reduces the dose received by the surrounding healthy tissue, other nearby organs, and the risk of possible side effects from the treatment. It can take between 2 and 8 weeks from your radiotherapy planning appointment for your treatment plan to be ready. Before your first treatment, your radiographers will explain what you will see and hear, and they will go over the side effects you may develop. The treatment machine may be fixed in one position or rotate around your body to give the treatment from different directions. The process will be the same as your radiotherapy planning appointment. You will need to lie on the couch with all the equipment you had for your scan and expose the treatment area. The radiographers will then use the permanent marks you had made at your planning appointment to move you into the correct position. This can mean a little shuffling and moving of your body on the couch. Your position is important, so please allow the radiographers to move you. Once you're in the correct position, the radiographers will leave the room so that they aren't exposed to the radiation during your treatment. The radiographers will watch you carefully on the CCTV from the control area outside the room. During treatment, you will be alone in the room for a short time, but the radiographers will be watching and listening to you all the time. It is important to keep still until the radiographers tell you that the treatment is finished. This process will be repeated each treatment day. Occasionally, it will take a little longer as the radiographers carry out routine checks on specific treatment days to make sure you are always in the exact treatment position. Everyone is different, and radiotherapy can affect people in different ways, depending on the dose you are given and what area of your body is being treated. Most side effects for radiotherapy are mild, and feeling very ill is rare. Some side effects include tiredness, nausea, loss of appetite, sore or itchy skin, or some hair loss in the treated area. Most side effects can be managed, and our radiographers will monitor you every day during your radiotherapy treatment. You will be seen in our on-treatment review clinic by a doctor from your team or a specially trained review radiographer. You may also attend the radiotherapy nursing department as part of your skincare during treatment. In addition, you may also be seen by other allied health professionals who are part of our multidisciplinary team. Overall, radiotherapy is quick, painless and non-invasive, with most treatments given as an outpatient. All treatment is tailored to your individual needs, and as the treatment is targeted to the treatment area only, it limits the potential for side effects. The following is some additional information which may be helpful for you before, during and after your radiotherapy treatment at the Cancer Centre, Belfast City Hospital. There is a children's waiting area where you can stay with your children and a small courtyard garden located off the assessment suite waiting room. We use a buzzer system to call you for your radiotherapy treatment appointments. You will be given a buzzer each time you check in for treatment, and this will work anywhere on the ground floor of the Cancer Centre, including the garden. If you are attending as an outpatient for radiotherapy and travel by car, you are entitled to free on-site car parking. You will be issued with a single ticket when you attend for your radiotherapy planning appointment and a weekly ticket thereafter for the duration of your radiotherapy treatment. Please remember to ask for your free car parking ticket. External radiotherapy machines are very big and may make you feel nervous when you see them for the first time. You may find it helpful to attend one of our monthly radiotherapy patient information evenings. These are usually held on the third Tuesday of each month at 7 p.m. There is a radiotherapy information and support service provided by the Information and Support Radiographer for patients, relatives and carers. The Macmillan Support and Information Centre, a Belfast Trust service, provides additional support for people affected by cancer. It offers general support, a listening ear, and can help with specific things such as emotional support, relationship issues, benefits and welfare advice. A complementary therapy service is also in place, kindly supported by Friends of the Cancer Centre at Belfast City Hospital.